Strepsils antiseptic combined preparation for local use in anti-practice and dentistry. It has an antimicrobial effect, active against a wide range of gram-positive and gram-negative microorganisms. It has an antifungal effect. Natural medicinal additives that apart of the drug have a softening effect on the mucous membrane. Indications: treatment of infectious and inflammatory diseases of the oral cavity and pharynx. Relieves pain and soothes irritation in the throat. The drug can be used for people with diabetes, does not contain sugar. How to take, course of administration and dosage. Locally. Adults and children over 6 years of age. Swallow 1 tablet every 2 to 3 hours. Do not take more than 8 tablets in 24 hours. Do not exceed the indicated dose. The duration of the course of treatment is no more than 3 days. If symptoms persist after taking the drug for 3 days, stop treatment and consult a doctor. Contraindications: hypersensitivity to the component of the drug. Children age up to 6 years. Use during pregnancy and during breastfeeding. The use of the drug during pregnancy and during breastfeeding is possible only on the advice of the doctor if the intended benefit to the mother outweighs the potential risk to the fetus and child. Special instructions: the drug can be used for people with diabetes, does not contain sugar. It is recommended to take the drug in the shortest possible course and in the minimum effective dose necessary to eliminate symptoms. The composition of the drug includes isomaltose and maltitol syrup, which can have a mild laxative effect. If symptoms persist or if a fever or headache occurs, you should consult a doctor. Side effects: allergic reactions are possible.